Okay, so hello and welcome to iTenif Healthcare Solutions webinar. Today we're going to be presenting on using NextGen Share in the real world. My name is Chelsea Grover, and I'm the Marketing Communications Coordinator for iTenif. I'd like to take a moment to explain the process for today's presentation. First, I'd like to mention that this webinar will be recorded. Next, for those of you who aren't familiar with iTenif, I wanted to share a bit of who we are with you. We've been in business as iTenif since 2003, but we have been NextGen users since 1997, EPM version 2.3. We specialize specifically in NextGen Healthcare. Our development teams know how to get data into, out of, and around NextGen to customize and tailor it to meet our clients' unique needs. Our purpose in life, the reason we exist, is to create delighted clients by helping them get the absolute most out of their NextGen software investment. It is also our passion to provide solutions for our healthcare provider partners, which in turn help them to improve patient care, enhance the patient experience, and maintain a financially healthy practice. We really do everything NextGen, from consulting to hosting to customization to support, and we have two NextGen add-on productivity solutions, ChartGuard and Refund Manager. We're here to help. Next, I wanted to bring your attention to some of our upcoming webinars that we'll be offering. On March 16th, we'll be presenting the steps to a patient-centered medical home. In it, we'll break down the process, starting with eligibility, working our way to the benefits of NextGen's newly gained PCMH pre-validation, and ending with a complete step-by-step guide for practices to gain PCMH accreditation. Future webinars will also cover quality care program reporting. You can either register now on our website or wait until the webinar for an invitation from us. Oh, and we're going to be adding a webinar shortly based on the new care guidelines that were released by NextGen this past Monday, so keep your eyes out for that. Okay, so back to NextGen Share. At the end of the presentation, we're going to open the floor up to questions from you. We will answer all the questions at the end, but you may type them in the questions area of the webinar control panel whenever they occur to you. For your reference, we'll also be emailing links to the recordings and PDF of the presentation later this week, as we do with every webinar. Finally, for audio clarity purposes, everyone's phone will remain muted throughout the entire webinar. If you experience audio issues, please use the chat box to let us know so we can resolve them. And again, questions may be entered in the questions box. So without further delay, I'd like to introduce our four presenters for today: Mary Hart, Lindsay Lanning, Cindy Kincaid, and Billy Lawson. Mary Hart is iTenif's Client Relationship Manager. She has been with iTenif for nearly 7 years and has worked with NextGen for 9 years. She helps her clients with NextGen Share every day, ranging from training people on it, answering questions, and understanding its intricacies. She also worked with the tech team to get it tested and implemented during the practices during the initial rollout phase. Lindsay Lanning originally joined us from the Ohio State University intern program while she was getting her degree in Health Information Management Systems. After graduation, Lindsay joined our team as the Healthcare Informatics Coordinator, where she spent her time immersing herself in the ever-changing healthcare IT environment and educating the rest of the company on new issues and trends in the industry. Cindy Kincaid is the Vice President of Consulting Services at iTenif and a Certified Practice Management Executive. With over 25 years in the IT healthcare industry and 9 with iTenif, her experience runs wide and deep. This makes it possible for her to provide the insights needed to help healthcare organizations experience great success no matter what the challenge is. Billy Lawson is the Product Specialist at iTenif. He has been a member of our interface team for 3 years and is currently responsible for installing and testing NextGen Share. Billy has spent many late nights in attempts to make sure your Share experience will go smoothly. Billy will be here to answer questions at the end. Okay, Lindsay, so I'm going to go ahead and pass the webinar off to you. Feel free to get started when you're ready.
Great, thank you, Chelsea. Hi, everyone, and thank you for joining us today for our webinar, Using NextGen Share in the Real World. This past year has been a whirlwind of change in the healthcare industry, and at the cornerstone of that change has been an increased importance on interoperability. Together, we will look at why interoperability is important and how using NextGen Share in the real world can help you add to the nationwide goal of interoperability. Today, we will provide an overview of the NextGen Share functionality, as well as how to set up NG Share for your practice. We also want to look at NG Share in the real world from a client's perspective, delving into client experiences of what works, what difficulties providers are facing, and how to maximize the benefits of NG Share for your practice. So in today's webinar specifically, we will look at an introduction to interoperability, so just briefly looking at what it is, why it's important, and some key challenges facing interoperability. Then we'll move on to NextGen Share, what it is and why use it. Next, we will look at what the Direct project is and what being Direct Trust Accredited actually means. And once we have this background information in place, we will move on to the actual NG Share setup and functionality, where Mary Hart will walk us through the referral process using NextGen Share. And finally, we will bring it back to the client to gain an understanding of the benefits and challenges real providers are facing using NextGen Share today, and then looking ahead at what's next for NextGen Share. So I think a great place to start off is looking at what interoperability is. So I've provided two definitions, one by the Health Information Management and Systems Society, or HIMSS, and the other by the American Health Information Management Association, or HIMA. HIMSS says interoperability describes the extent to which systems and devices can exchange data and interpret that shared data. For two systems to be interoperable, they must be able to exchange data and subsequently present that data such that it can be understood by a user. And the HIMA says, interoperability is the ability of different information technology systems and software applications to communicate, to exchange data accurately, effectively, and consistently, and to use the information that has been exchanged. The takeaway here is that overall, interoperability refers to a healthcare system's ability to connect with other systems. Simple enough. So why is interoperability so important? Well, the EHR system interoperability is a necessary step towards transforming healthcare into a system that can achieve goals of improved quality, efficiency, and patient safety. For example, the use of interoperable EHR systems could better enable healthcare providers to view results collected by other providers to avoid duplication, evaluate test results and treatment outcomes over time regardless of where the care was provided to better understand a patient's medical history, share a basic set of patient information with specialists during referrals, and receive updated information after the patient's visit with the specialist to improve care coordination, and view complete medication lists to reduce the chance of duplicate therapy, drug interactions, medication abuse, and other adverse drug events. The rapid expansion of value-based reimbursement is exposing unmet needs for active coordination within and between healthcare organizations. If there's a lack of interoperability, healthcare providers can't achieve true care coordination, and data sharing is needed to make vital assessments and deliver high-quality care. And this is why achieving interoperability is becoming one of the nation's top healthcare goals. So what's stopping this from happening? Let's quickly take a look at the key challenges related to interoperability. These would be a lack of mandated health data standards, differing state privacy rules, accurately matching patients' health records, costs associated with interoperability, the need for governance and trust among entities, and information blocking. These barriers to interoperability are significant and prohibit nationwide interoperability. But I believe NextGen Share does address each one of these barriers and has been able to surmount them. So let's look at NextGen Share and start with the basics. What is NextGen Share? Well, according to NextGen, NextGen Share is a nationwide network connecting providers to support secure clinical data exchange. NextGen Share allows clients to discover and connect with external providers. It allows users to find connected providers and organizations, compose and exchange a referral with clinical documents, and count such transactions toward their meaningful use attestation. This dramatically simplifies today's manual referral workflows, which require faxing or paper shuffling. So let's break that explanation down and provide a few more details. NextGen Share was built using NextGen and Mirth integration and provides secure connectivity between both NextGen Healthcare and non-NextGen Healthcare providers. NextGen Share supports interoperability across all certified EHR vendors to enable the exchange of clinical information. It includes a searchable provider directory and message translation between supported formats. Providers can exchange clinical data files such as C-CDA files and attachments, referral request letters, and intake notes. Access to these patient files and the ability to share them will improve patient safety and patient health outcomes across the network. Basically, NextGen Share gives providers access to a national provider network, connecting all NextGen clients together and connecting NextGen clients to external systems. It also integrates referral ordering into a user's normal workflow and supports secure sharing of EHR documents. So why are people using NextGen Share? NextGen Share ensures you aren't participating in information blocking, and also satisfies meaningful use modified stage 2 requirements. So it automates meaningful use calculations to ensure the attesting provider has met the thresholds necessary for objectives requiring interoperability. It supports the secure sharing of EHR documents and C-CDAs, which allows better communication between physicians and increased care coordination for patients. It allows users to search and discover external providers and organizations. NextGen Share supports connectivity to multiple networks and federated HISPs to allow connections to providers using different EHRs. And finally, it decreases manual data entry, where possible errors can be made by generating referral packages that support C-CDA creation and multiple document attachments. So I mentioned it automates meaningful use calculations, but which objectives specifically fall into this category? The first is Objective 10, Public Health Reporting. To satisfy Measure 3 of this objective, Specialized Registry Reporting, providers may use NextGen Clinical Registry Service, which connects to the list of registries you see on your screen through NextGen Share. Another meaningful use objective that clients would achieve from using NextGen Share is Objective 5. So the EP who transitions their patient to another setting of care or provider of care, or refers their patient to another provider of care, provide a summary care record for each transition of care or referral. By setting up NextGen Share so it is integrated into the EHR in the referral template and medical summary utility, it automates meaningful use calculation for referrals sent using direct messaging between providers. I think this is a huge benefit to providers and really makes the referral process more efficient. So as we go through the rest of the presentation, we will focus on sending and receiving a referral using NG Share and direct messaging. As you've probably noticed, I keep mentioning direct messaging, which is key to the secure exchange of information when using NextGen Share. But let's take a look at what direct is and how it works. NextGen is currently working with the Direct project, and the Direct project establishes standards and documentation to support simple scenarios of pushing data from where it is to where it's needed in a way that will support more sophisticated interoperability in the future. The Direct project specifies a simple, secure, scalable, standards-based way for participants to send authenticated, encrypted health information directly to known, trusted recipients over the internet. Those Direct project specifications and protocols are now known as the Direct Standard, which meets federal requirements and ensures secure communication. So how does it work? Well, a message is sent between providers using a HISP. A HISP is a health information service provider. A HISP securely transfers encrypted health information in a standardized format between healthcare providers. Basically, it manages the trust between senders and receivers. If two healthcare providers have the same HISP, information moves directly between the providers' computers. If two providers have different yet compatible HISPs, the information leaves one provider's HISP, is securely sent to the other provider's HISP, and is then forwarded on to the other provider's computer. So if we look at a scenario where two providers have different but compatible HISPs, when a message is sent, it will go from the sender to the sender's HISP. So a provider, let's say Dr. Smith, would use their EHR to generate a clinical summary and send it to Dr. Johnson using a direct project address that Dr. Johnson gave him. Dr. Smith's EHR system authenticates to establish its identity to a HISP, then encrypts and sends or pushes the message, including the clinical summary, to Dr. Smith's own HISP. Then we get to step 2, sender's HISP to receiver's HISP. After locating the address of the receiver's HISP, it communicates with the receiver's HISP through similar steps of authentication, encryption, and message transmission. And once the message has arrived at the receiver's HISP, it needs to be delivered to the intended recipient, or Dr. Johnson in this case. So then we have step 3, the receiver's HISP to the receiver. So Dr. Johnson's software authenticates to the HISP that Dr. Johnson is using a direct address, and then gets the message, displaying it within an inbox of messages. When selecting a HISP, organizations should make sure to choose one that is certified by the Direct Trust Agent Accreditation Program, or DTAP. This accrediting body verifies that a HISP provider is a trusted entity with appropriate security protocols and business practices in place to safely transmit information. Certified HISPs can seamlessly communicate with one another, enabling interoperability. Conversely, an uncertified HISP may not be able to share information with as many other HISP providers, thus limiting an organization's data exchange reach. And this is good news for NextGen Share users since it is now DTAP certified. So DTAP validates and supports compliance with the technical, security, trust, and business practices required for direct messaging. This certification ensures that NextGen Share is meeting the highest data privacy and security standards. So this organization facilitates HISP-to-HISP communication and ensures that all HISPs are following similar procedures for security and authentication. This also extends the provider's reach by connecting to other HISPs in the Direct Trust network. NextGen Share users can connect with their own NextGen Share directory and all of the HISPs you see in this image that was supplied by NextGen. So I keep saying direct messaging, but what exactly is a direct message? Well, it's not an email, but it works in the same way. It's a secure SMTP, or a simple mail transfer protocol. It requires a direct address, which again is not an email address, but looks similar. The address would be different for each provider, most likely starting with the provider name with @direct.nextgen.com after it. And this is what is used to exchange health information through NextGen Share. So let's move on to the actual NextGen Share setup. NextGen Share is now in general release. It's available to all clients who've met the prerequisites, which we'll go over later on in the presentation. And onboarding through NextGen Share portal connects your practice to the NextGen Share network. First, you'll need to download and install the NextGen Share KBM templates. Next, you'll need to complete the registration process on the NextGen Share portal. The NextGen Share portal will provide you the download link and instructions to complete the NextGen Share installation on your Rosetta server. You may choose to install NextGen Share into either your test environment or your production environment. The test environment, referred to as staging, can be connected to your NextGen test database. And the prod environment, referred to as production, is a live system connected to your NG production database. Please note, if you do the onboarding for the staging and then you wish to do so for production, you will need to start completely over and come back to this main page. So to begin the onboarding process for NextGen Share, you would navigate to the NextGen website under Products and Services. You can click on the NextGen Share link located in the Interoperability section. Then once you're on that page, scroll to the bottom of the NextGen Share page and click the www.nextgenshare.com link to log in and begin. So the first of 3 main steps involved with NextGen Share enrollment is creating a Share profile. This is just a simple form that has required fields such as demographics about your practice like name, address, phone number, fax number. NextGen does pre-populate some information it has on file for you, which is pretty nice. On the form, you must pick a specialty, but there is an option for multi-specialty for organizations with providers dedicated to more than one specialty. And you must pick a subdomain before you can continue. A subdomain is a unique identifier that is part of each direct address assigned for your providers and organization. It facilitates identifying the practice that a provider is associated with. So it's the part of the address between the @ between the @direct dot phrase and then before the .nextgenshare.com. So just an example would be John Smith at direct.myuniquepractice.nextgenshare.com, where my provider's name is John Smith and my practice name is My Unique Practice. So it's really the same process as picking a username somewhere for picking a subdomain. It must be unique, so you may need to enter it a few times until you see a green thumbs up appear, confirming this is not being used by anyone else in the NextGen Share network. Now, once you agree to the terms and conditions and continue enrollment, it will take you to step 2, connect your company to the Share network. Here, you will need to enter the email of the user performing installation and it will send a license key and install instructions to them. Download the NextGen Share installation kit on the Rosetta server that you would receive in that email. Run the installation wizard. Once installation is successful, you will run a NextGen Share network connectivity test. Once the connectivity test signals success, enter the license key and then wait for a registration success notification. The NextGen Share installation complete page will appear where you can click Finish and navigate back to the portal. NextGen Share portal will confirm installation was successful. Notice this is why I brought up going through the onboarding process again for production, because the installation kit that you receive in that email is specific to each environment. Again, I know we just walked through this quickly and without any visuals, but we just wanted to give you an overview, and really this whole thing is run through an installation wizard which tells you exactly what to do at each step. So once you hit continue under the installation success message on the Share portal, you will then be taken back to the NextGen Share portal homepage, where you will find the core service section, which will show you the status of connection to your EHR environment. And you also have this messaging service section that needs to be activated. And to activate this involves 3 steps as well. And these 3 steps are check prerequisites, verify identity with DigiCert, and enable direct for providers. So first off, you need to check prerequisites. This will check your EHR version, KBM version, and KBM hotfixes required. Then, once you verify you meet all the minimum requirements, a link will appear that says Download Verification Form. This takes you to the next step of verifying your identity with DigiCert. And you do this by downloading and completing the ID verification form, and then having the completed form notarized and submit it using DigiCert. After this, the NG Share team will actually install the security certificate on your behalf. So once this is completed, the next time you log into the NextGen Share portal, the messaging service panel will connect to the EHR to retrieve provider and practice information and automatically create direct addresses for all your providers. Once this is complete, this section will update to show the number of active practices and providers retrieved from your EHR databases. And notice the number of messages will change to reflect the number of messages in the last 30 days, while your practices and providers will largely remain unchanged. At this point, installation is complete, and you would be looking at a fully functional NextGen Share portal. Notice the different sections found on the page that will help you and your practice manage your NG Share settings. So the administration panel allows you to control your user profile and your message center. The services section gives information on each service available to you through NextGen Share. The core service section shows your connectivity to the NextGen Share network, while the messaging service panel allows you to manage your practice and message settings for providers. And then there's the Share community section, which includes links to various different resources such as the NG Share video library, the ability to search the NextGen Share directory for providers and organizations, as well as adding external providers. So if we follow the Add External Providers link under the Share Community section, we will be directed to this page where you can successfully fill out a form and submit it to add a provider to the NextGen Share directory. The NextGen Share directory is comprised of data from a variety of sources, including NextGen EHR customers, third-party HISPs who have signed directory sharing agreements with NextGen Share, the Direct Trust directory, services and programs, and user submissions to the directory. As a NextGen Share customer, you can submit new addresses to the NextGen Share production directory. As long as the provider has a direct address, they can be added to the directory. This means that the address managed by other Direct Trust HISPs are trusted and can be added to the NextGen Share directory. Now, adding addresses to the NextGen Share directory can only be done in production. This is because the staging environment only supports messaging to other staging customers, and it's not configured to allow messaging between HISPs. Notice you are able to import a single provider, or you can select the Import Multiple Providers option at the top of the page to do a bulk import. When you add a provider to the directory, you would choose a value from the search by field, so either MPI, organization, or provider. Then use the search criteria to find the provider and confirm your selection. This selection will actually pre-populate the values into the fields at the bottom of the page, review and confirm the pre-populated data, and enter in the provider's direct address. Check the box, which starts off with I understand, and then click Submit for review and processing. If you add a single provider with a trusted address, they will immediately be available in the directory to you. But if you do a bulk upload, it will take some time for NextGen to actually go through, verify, and add the providers in. Now, if you want to view the providers in your practice, you can click on the messaging service link, and it will take you to the page you see here. On this page, you can search for a provider using the Find Provider tool. You're able to change their unique address by clicking the existing address, making your changes, and then saving by clicking the check mark. Notice you're not changing the subdomain, which you picked during the setup. That stays standard for everyone in your practice. But you are able to change the beginning of the address before the @ sign to identify the provider. You can also turn on or off direct messaging for a provider or a whole practice if you wish by sliding the status bar from on to off. But please note, if you do slide it to off, you will remove them from the directory. All right, so we've gone through what NextGen Share is, the background information on what a HISP is, what a direct message and address is. Now we're ready to look at NextGen Share functionality. And I'm actually going to hand it over to Mary Hart, who will be taking us through the referral workflow using NGShare. And Mary, I'm going to pass it over to you whenever you're ready.
Great, thank you, Lindsay. Okay, let's start by looking at the different outgoing referral workflows. Referrals can be sent using the referral template or the medical summary utility. Both the template and the medical summary utility can send the C-CDAs via NextGen Share. The grid at the bottom of this slide shows the differences between using these two workflows. A few important notes are that when using the referral template, the C-CDA is longitudinal and it includes all of the patient information, whereas the medical summary utility allows the user to select particular information and data they want to include in the C-CDA. Also note that EHR and encounter level documents, such as Master IM, can be included using either workflow. ICS attachments are supported in UD2 for the medical summary utility and in KBM 8311 for the referral template. When looking at the outgoing referral workflow specific to the medical summary utility, users will first create the referral order utilizing the referral order template. Then they open the medical summary utility on the utilities menu bar and search for the provider that they are referring to. They then locate the referral, attach any documents, and send the referral via NextGen Share. Some of the benefits similar to what I mentioned last slide is that users can choose the clinical content when using the medical summary utility. ICS images can be attached in UD2, and the NextGen Share directory search is the same as on the template. The medical summary utility also allows you to preview the content before sending. When sending a referral order using the referral template, the workflow is very similar to the workflow users use today. First, they will search for a provider using the NextGen Share search window, compose the referral and attach any encounter documents or images, and place the order for the referral and send it via NextGen Share. The meaningful use calculations are automatic and are tracked in advanced audit, and a cover letter is included with each referral. You can also see the date and time that the C-CDA was sent in different grids and templates within the system, and we will share screenshots of where these are in an upcoming slide. So in summary, when using the built-in KBM referral template, you will search for a provider, create the referral, and then send the referral. These screenshots show the workflow for using the referral template to send an outgoing referral via NextGen Share. The referral template can be launched from various places within the EHR, but most commonly from SOAP or Intake. Users will first click the NextGen Share icon, which is the orange button located next to the provider name, to search for a provider using the NextGen Share provider directory. When the search window opens, notice that My EHR and Share are both checked. This allows users to search both the NextGen database and the NextGen Share database for providers. Within the search window, you can search by provider name, organization, specialty, or location. Once you enter the search criteria, you will select search and select the correct provider. There are different icons next to the provider's names in the search results. The blue badge icon is for an organization or practice. The red balloon icon is for providers in My EHR directory. And the small physician icon is for providers in the Share directory. After you select a provider, it takes you back to the referral template to add diagnosis, clinical indications, and attachments if required. This is the same workflow that is typically followed while utilizing the referral template. To add an EHR encounter document or image to the referral, click on the Details button. You can add up to 8 attachments to each referral. If you want to attach ICS images utilizing the referral template and you do not have KBM 8311, you can open a NextGen ticket and they will allow you to make this change. When you have finished entering all of the referral information, you want to check the C-CD document sent checkbox that's in the screenshot on the left and click Add to place the order. The last step will be to highlight the order and click Share to send the C-CDA. When you press Share, 4 things happen. The new C-CDA is generated, it collects attachments, generates a cover letter, and creates a referral package and sends it all using direct messaging. There are a few different ways you can check to verify the referral went through successfully. The screenshot on the left is of the referral grid, and you can see the comments section, which shows the date and time the referral was transmitted. On the right is a screenshot of the orders management template, where you can click to open the order details. You can see that the clinical information comments section shows that the C-CDA was sent and the details associated with that. When providers receive a referral from NextGen Share, incoming messages go into the inbox for the assigned recipient and create a task. It also puts the incoming message in the patient's chart. These tasks can be received by multiple people depending upon the routing rules you've established for the provider and file maintenance, which we will cover in an upcoming slide. Providers are configured to receive the incoming referrals, but these notifications can be turned off. In order to do so, you must open a ticket with NextGen. Otherwise, the provider will also receive the incoming referral in their inbox. Incoming HIE documents can also be set up to go to a provider's PAQ. This is done in the PAQ setup in System Admin. When the incoming task is accepted and you go into a patient's chart, you can access the C-CDA cover page, attachments, and C-CDA in the categories view of the chart. This is the same location where scanned images and documents go into. Also note that for any referrals that are sent out from your practice, it saves the outgoing referral, attachments, and cover page in the images view of the categories as well. And these are just a couple screenshots to show you what this data looks like. This is a screenshot of the cover letter that was sent with a C-CDA. If you want to customize or add a special cover letter for your practice, it is recommended that you create this cover letter as a document within the EHR that you can then attach to the referral. This is a screenshot to show an example of what an attachment within NextGen Share will look like. It's a separate item from the C-CDA. So if you look on the right-hand side under categories, you can see it's a separate item underneath that incoming referral. And finally, the last screenshot shows what the C-CDA looks like. There's a table of contents that we've taken out on the left that shows you everything that's included, from allergies to medications to histories, immunizations, patient plan, HPI, and chief complaints. Setting up notifications when the C-CDA is received. So in order to assign other users other than the provider to receive incoming referrals, so referral staff, clinical staff, these changes would be made in file maintenance under the order result notifications option. You would first click New, set the external system ID as NextGen Share, select the provider, and designate the user or users to receive the incoming referrals. Some other important notes. The directory will not have all providers, only ones that use a direct trust HISP. If a referral is unsuccessful, an alert will be sent to the referral sender in their inbox. If a patient is not an exact match to your system, the referral is sent to the Rosetta holding tank to be matched. So for unknown patients, these are the same place that your unmatched lab results go, and users can match or add the patient from the Rosetta holding tank, or they can decline and reject the incoming message. C-CDAs can be received or sent to any provider registered to a direct trust accredited HISP, regardless of their EHR product, and you can add providers if you know their direct address. So now we are going to be talking about NextGen Share in the real world, and Cindy Kincaid will take it from here.
All right, thank you, Mary and Lindsay. All right, so let's talk NextGen Share, the real world. We've talked about all the wonderful things and all the textbook things that you can do with it, and I can tell you we've worked with all of those, but let's move on and talk about some of the other things that you may want to consider or think about as we move into this process. So first of all, what does it cost? NextGen Share is free to all clients who have met the prerequisites. There's no cost to purchase, no cost to maintain, no cost to install, no need to purchase new hardware, no per transaction fee. NextGen Share does not require the purchase of the direct interface. So free isn't always free. Let's not forget the soft cost. There's no physical dollars that have to be expended to obtain the product. However, as we move on, you're going to want to consider the minimum requirements. First of all, you have the items to take care of prior to testing, the must-haves to install. You must have 5.8 UD1 hotfix 69 or greater installed in order to use NextGen Share. You must have a minimum of KBM 833 or greater. The Share KBM templates must be installed. The NextGen application must be installed on the Rosetta server. A minimum of PowerShell 2.0. A minimum of ASP.NET MVC3. And a minimum of .NET 4.5.1. So if any of these things are not in place, when you attempt to install NextGen Share, it's going to go through and basically check to see, as an example of the screenshot on this that we've provided, is do you have NextGen 5 EHR 5 UD1 in place or greater in production. So it's going to check and it's going to know, and it's going to go through the checklist to make sure all of these things are in place. If they're not, you must add them, and those can be a cost associated with these type of upgrades. Other considerations that you have to think about is the time it takes for installation, the time it takes for training. There is training involved. There's staff training. There's setup and testing. And these are all soft costs. These are costs that you have to consider of your time and your personnel and just really how you're going to deploy this and fit this into your workflow. In addition, some of the things that have happened as we put it in, problems that clients are facing. And things that we've heard as we've moved this out. This is relatively new, and not everyone is participating with the meaningful use objectives and the registries. It's becoming very, very popular very, very quickly. However, let's talk a little bit about some of the problems or challenges. I like to call these challenges. Not all doctors or practices are in NextGen Share. So while you may be sending out a referral and wanting to do it, the physician you want to send it to may not be participating. Many providers are not even ready for automated referrals at this time. So again, you can send it, but they may not pick it up. Everyone is not in the directory, and that is a little bit different than not all of the doctors or practices are in NextGen Share. There can be providers that are just not in the directory, period, that are not even associated with NextGen. And then not all providers are on a direct trust HISP, and it must be a direct trust HISP even if it is not directly associated with NextGen Share. Not all providers are using an EHR, and many times referrals simply go unread. I had one of our clients ask us once, what could we do about the fact that when you send it out and it goes into another provider's holding tank, for lack of a better word, you don't get a response, you don't have anything, you call them up and they say, oh yes, we get those, but we really don't do anything with them. And that's something that's just going to come and improve over time. And I think every week, month, and every interview we conduct, it's getting a little bit better as more and more people are adopting this type of technology. We've talked about some of the challenges, but let's talk about some of the benefits that we've heard. It drops the complete C-CDA and cover page into EHR automatically. The workflow is extremely easy, and it really is. You do need to make sure that everybody's on board, but it's really pretty easy to deploy. You no longer need to print and fax documents. Everything's electronic. And again, that's a bit of an everything, but if you are using this, it takes away that functionality, and it also takes away some of the HIPAA risks that are associated with faxing. It automatically tracks meaningful use compliance for interoperability objectives, and users are able to import patient clinical data from the CDA into the patient chart utilizing the clinical reconciliation function. So you can now import medications, allergies, problems, diagnosis codes, and procedures. So not only can you receive the information, you can actually update your chart with this information. We reached out and polled a couple of our clients, and as I said, this is very new, so we didn't get a lot of things, but one of the things that we did get from our clients on a positive is that we received the CDA from 2 commercial pharmacies, CVS and Walgreens, and when a patient receives a vaccine, it's nice that the vaccine information is available to view. The NextGen generates a CDA, all outside lab results from the orders module, and all vital signs from all the encounters appear, which is really nice. On a negative side, or on a challenging side, the actual CDA document can be extremely long, since it includes all sorts of information that may not be relevant to a particular referral. So some of the providers I've heard have referred to it as junky, some of them have called it messy, or just too much information. And I know that NextGen is working on that, and then also with the medical summary utility, you might be able to look at that and clean some of that up as well as you're using it. So what's next for NextGen Share? Well, there's been a lot of activity this week, particularly with the registries, and while that isn't the topic for this webinar, there's just been a lot of discussion, so let's kind of go through what's up and coming. So first of all, changes to come. The SureScript HISP interface will be discontinued on July 1st, 2016. This only applies to clients who have a direct interface to SureScript HISP. This is not those that are using the e-prescribing in NextGen. UD2 features an increased number of providers will now show in the provider search window, more than 4. There will now be a favorites list and a most recently used list, so that's going to be nice. The type ahead feature will be enabled, so results for letters and partial names will appear and the entire name is not required. So an example, a user will be able to search GOR in order to find the provider Gordon. We received this actually on Monday to the NextGen Clinical Registry Update and decided to include it. So this is what can I expect on Monday 2/22 if I'm on a UD2 in production environment. What we found is that with the increase in clinical registries due to the fact that the deadline is Monday the 29th, everyone is trying to determine how to register, and for those registries that we saw in the beginning of the webinar that utilize NextGen Share as the vehicle, there are a couple of things to keep in mind. First of all, if you're on a UD2 in a production environment, you now log into NextGen Share and onboard to the service. The title for the clinical registry service will be visible for clients starting over the weekend. Steps to set up the service on the portal are attached, and we will send that over to you if anyone that wants that. This is actually an excerpt from NextGen. The clients will need to reselect the same enrolled providers they submitted via the provider extract utility during the setup process. So basically what this is saying is that if you have used the provider extract utility, the list and spreadsheet that you were sending, if you're on UD2, you are naturally going to have to go to the registry website and register these, not the direct website, the NextGen registry website, and we can provide more details on this. So a couple of the questions that we had is, but I've already submitted my provider list. I have to do it again? Unfortunately, yes. This information was only used to generate attestation letters and was not used to build the setup as the service was not available at that time. And literally this just came out this week. Provider changes made in the portal from this point forward will be fully automated and updated with the C-CDAs on a weekly basis. That's Sunday nights. And what can I expect on Monday 2/22 if I'm on UD1 in a production environment? You will not be able to install the service because you will fail the prerequisite checks for UD2. So first of all, this new service is not available to you. Provider changes and additions remain manual, and you will need to continue the use of the provider extract utility until you are on UD2. So we've had quite a few questions on this week, and depending upon what version you're on, you're getting different methodologies in being able to upload the clinical registries if you're using those with NextGen Share. There are a lot of other registries, such as the cancer registry and different registries that don't utilize NextGen Share, so it can get really complicated. So just think about the beginning of the slide of the presentation with those list of registries that are going through NextGen Share. The letters of attestation will come from the registry on or about April 1st, 2016, and the enrollment date will be the SOF date or 2/29/2016 if you're heading down to the wire. And if you're uncertain where your practice stands, let iTentive help by assessing your current readiness, providing recommendations, and assisting with the implementation of new processes and procedures. If there's something that we can help you with as it relates to meaningful use or any other workflow challenges you're facing, please feel free to reach out to us and we can take you through some of our programs. And any next steps, if you want to learn more about iTentive or learn about the programs we offer, you can visit us at itentive.com. You can sign up for our informative webinars and blogs, consider our 3-day fixed price on-site consultations, and test drive our products.
Okay, thank you,
Open
Cindy.
it up for questions.
Okay, and we already have some questions coming in, so we're going to start with those. And remember that you can ask your questions in the questions area of the webinar control panel. So the first question, we occasionally get referral questions to include scanned documents, radiology, consults, etc. Currently, we do not have an option that I can see to include these documents. We are using medical summary utility. Do you have any suggestions on how to attach these scanned document types?
I can answer that.
Mary, why don't
This
you
is
take
Mary.
that one?
So, sure. So if you're on UD2 and you're in the medical summary utility, it should show as an option under the options. So my question would be, if you're on UD1, that may be why you're not seeing it as an option. But if you're on UD2, you can also go into, like I said, the referral template. And if you're not on 8311, you would be opening a NextGen ticket, or we could open it up on your behalf, and we can get them to add that functionality to the template for you.
Thanks, Mary. Okay, next question. Is there a HISP or HISPs in Hawaii?
Well, I'll take that one. I don't know. I'm going to be honest, I don't know. We can check, and I will either Lindsay or myself will do that, and perhaps we could make a personal trip. And just
Can I get in on that?
Can't find it online. Yeah, in fact, all of the presenters would be very happy to go and check that out. So Kimberlyn, I think, is the person who asked that question. We will actually look it up and see if we can find one for you. I don't know the answer to that.
Okay, thanks, Cindy. Next question. What are the known obstacles for NextGen clients with high levels of content customization?
This is Cindy. I'll also take that one. I can tell you we have clients that are using NextGen Share that are very heavily customized, and in many cases they have, it's installed on the referral template out of the box, but it can be customized in Template Editor to be placed somewhere else. I've actually seen this with one of our clients, and we were chatting about this when we were looking at some of the known issues. So you can modify it. As far as any challenges that have faced, I haven't seen them. As we all know, in the NextGen and with customization, I can't swear that won't be an issue. So I would really have to know more about it. But honestly, we've got some very heavily customized clients using NextGen Share.
Okay, thanks, Cindy. Next question. Our providers place the referral orders, but our checkout staff do the actual sending out of documents needed to go with the referral. Will this workflow work with Share? Can the provider order referral and not send anything, and can the checkout staff go and get into the referral and send the information?
This is Mary. I can take that one. So if the provider places the order for the referral, the order still has to be sent through Share. So if they place the order for the referral, they can just complete the order, and then the checkout staff can go back into the referral order screen, select the order, and click Share, and actually do the sending of it.
Yep. Thanks, Mary. Okay, next question. Incoming referrals. We never have the option to import for clinical reconciliation. Why is this?
This is Mary. I can take that one as well. You should have the option to do the clinical reconciliation from the clinical reconciliation module. I'm not sure specifically why you aren't able to. We have your name, and I will take a look at this after the webinar, and hopefully we can connect it and see why you're maybe not seeing that option.
Okay, thanks, Mary. Next question. How do you create a custom cover letter? How do you create a custom cover letter for referrals?
I can take that one. This is
Okay.
Billy. Right now, there's no way to customize the cover letter. It's auto-generated by Share. So at this time, there's no way to customize that.
Thanks,
Right,
Billy.
and this is Mary. If you wanted to do, because I mentioned in mine that you could create a separate one, so you can't customize the one that's associated with the share referral, but you can create your own. Let's say in the document library, you could create your own referral cover letter with your heading and whatever content you want, and then add that to your referral order as an attachment. So it'll go over as a separate attachment.
Okay,
That's kind of a
guys.
workaround to it.
What exactly, or I'm sorry, what is the provider extract utility?
This is Billy. I'll take that one too. The provider extract utility is a utility provided by NextGen to go into your database and pull out your providers. There's some specific information they need from the database, and what they'll do is you'll send that back. Once it gets the file, it creates a CSV or a comma delimited file, and you just take that and you would submit that to the registries at NextGen, and that would actually allow you to enroll your providers for specific registries.
Thanks, Billy. Okay, next question. Will this PowerPoint be available? If so, where? Yep, we actually record all of our webinars, and then we upload a link to the recording as well as the PDF version of all of these slides onto our website, www.attentive.com/events-and-education. And later this week, I'm going to follow up with an email to everybody who registered for the webinar that will have a link to go there as well. And I'd expect that it should be up by tomorrow or Friday at the latest. So you can find this one or any of our previous webinars all in the same location there. Thanks for asking. Next question. Is share only used during referral order? Are providers only order and pick up, are providers only order and only pick up a specialty? Can share be used to order management or after an order is created?
This is Mary. I can answer that one. So you can add with template development if you want to put it on the orders management template. However, you can't use it after an order is created unless you search for a provider using the NextGen Share provider directory search. So let's say you don't have NextGen today or NextGen Share today, you place an order and you get NextGen Share tomorrow. You can't go back to that order because you didn't search for the provider using NextGen Share directory. So when you do use the NextGen Share directory, it does force you to, you can't just have a specialty. You have to pick where you're going to be sharing the referral. So either to a practice or organization or to a specific provider.
Thanks, Mary. Next question. Can providers create a referral order and have another employee use share to complete the order?
This is Mary as well. Really sort of the same thing. So yes, they can create a referral order, but if they do, and you don't want to have duplicate workflow, they would have to, again, search for where it's going using the NextGen Share search, and then they would place the order, and the clinical staff or referral staff can click Share to send it. But again, somebody has to search for the provider or receiving organization using the NextGen Share directory search.
Thanks, Mary. We are using NextGen Share, and we are getting duplicate referral orders. I know this is because the provider creates referral and tasks out to our clerk. The clerk then goes in and creates it using NextGen Share.
This is Mary as well. Yes, that's why that's happening. So the provider's probably going through not doing a search via NextGen Share, maybe just picking a specialty or free texting a provider and just hitting order, and then the clinical staff or referral staff is going back and actually searching for it with NextGen Share. So yes, that would place 2 orders in the system.
Okay, next question. We are currently installing Share in test, but are not anticipating using it with any of the included registries. Does this mean we do not have to worry about the registry deadline?
This is Cindy. I'll grab that one. No, it does not mean that. You do have to worry about the registry deadline. You have to pick the registries that you're using, and depending upon the type of registry, and we've had a number of calls and discussions about this, particularly this week as this deadline is approaching, you have to register at a minimum your intent. If it is one of the registries that NextGen participates in, then you really recommend that you do this through NextGen, either using the UD1 or the UD2 methodology. And going back to those soft costs, some of the registries have costs, some of them don't. So if you are getting ready to install Share and you have not submitted your intent at this point, you have to have it done by Monday. And the registry you're interested in is one of those that is utilizing NextGen Share, and not all of them are, then you will need to reach out to either us if you're working directly with us, or your NextGen sales rep, to make sure that you can get an estimate of what the registry is and get your SOS for that. So that's something that could be taken offline, but you definitely still have to worry about it.
Thank you, Cindy. Next question. Does MU count internal referral via NextGen Share?
I'll start that, and then Mary, you can jump in. We have struggled a little bit to get an answer to that. And I'm anticipating that the intent of this question is that you're in a multi-specialty practice and that you are doing an internal referral from, say, your primary care providers to perhaps your cardiologist that are all part of the same practice. My instinct on that is no. However, we were discussing that if you actually went out and conducted the referral using NG-Share, and we were trying to figure out a way to test this, so I haven't got to this. Our thought process is that if you went out and did the referral using NextGen Share and pulled it back in, it might count, because we don't know if it's intelligent enough to look at that. And Mary, I mean, we've had numerous conversations about this. I don't know that that's the intent for that to count. So Mary, what are your thoughts? I know we've had the same conversation. So
sure. Yeah, no, we've had those conversations. I don't believe the intention is to count an internal referral. So like the NextGen specification of the measure is supposed to exclude referral orders to the same practice from the denominator of the measure. However, if you're using NextGen Share, I'm not sure, unless you indicate that it's an internal referral, that it counts against you. So we can, like Cindy said, we can follow up on that and see if we can get some testing on that and get an answer back to you.
Okay, thanks, ladies. Next question. Okay, I might butcher this word or name, so I apologize. Per NextGen Charitably working on Share, yes, there will be HIPs connected in Hawaii.
Ah,
nice.
Well, that's good news, and thank you for that. I'm disappointed I don't get to go to Hawaii, but that's sad. I'm glad that we were able to answer the question. We'll make sure that if we did butcher it, that we get the actual answer out. But thank you very much for that information.
Thanks a lot. Sorry about that. Is there a character limit in the clinical details box in the referral template? Our providers currently use this area to free text details regarding the referral. The sent information is being placed here, and we want to make sure that the details will not be cut off if the provider has typed a significant amount of information in there.
This is Mary. I can take that one. Since it's a template field, it likely does have a character limit. I will check for you and get back to you today about what that exact character limit is. And also, as long as you can type that in the template, I would assume that the whole thing goes over. But again, I will test and make sure that we fill that field all the way, and I can test it on a C-CDA to ensure it's all captured.
Thanks, Mary. Okay, just to clarify, NextGen Share only integrates with the EMR system on the slide near the beginning of the presentation. For example, the majority of providers we refer to are on Epic. Would this utility be useful in communicating with these providers?
I can take this one. The answer to that is yes. I mean, I'm using that answer carefully. They would have to be involved in a direct HISP. And so if the Epic providers, and Epic is a pretty generic, I mean, it could be your hospital involved or anything. I mean, the continuity of care documents are something that everybody participates in. So that's an option. Whether it's going to import into their system, probably not. Epic's pretty closed in those type of things, although it would really depend on, I think, the HISP involved. If it's direct, there's no reason that Epic should be excluded from any of the others. So my opinion is yes. Again, it's going to be dependent upon what they're using it for.
Okay, thank you, Cindy. Next question. If a provider initiates a referral but does not attach necessary documents or send the referral, can the support staff attach these documents and then send through Share?
This is Mary. So the answer is no. So if the order is placed, the attachments need to be placed within that order before sending via Share. So if the provider places the order without those attachments, there's no way to go back in and associate attachments with that order.
What you might want to consider, though, is your workflow where the provider perhaps just initiates the order but doesn't actually send it, and then they complete the order and attach the documents there. That might be a nice workflow like we've talked about with some of the earlier questions that we had.
Yes.
Okay, thanks, ladies. Does anyone know how we will be able to be affected if the providers we refer to do not accept electronic referrals? After 12 days of using Share, we have encountered 35 providers that don't have an HIE address.
I'll jump in on that one, and Mary, maybe you have something to add. It's really, when you say how you will be affected, are you talking about I would be interested in what you mean exactly by that. If you're talking about the meaningful use requirements, everything, is my understanding if you are sending it, then you are meeting the objective, and therefore you are participating because
Cindy,
it's going to be included.
Cindy, she just clarified meeting our MU.
Okay, so then answering that question, it's going to count because you're sending the referral. Now, from their perspective, the other providers will have their own issues to address if they're not participating. I would also put initially, as this is becoming, and I know this is kind of a pain, I personally would put some type of manual process. If after 12 days of using Share, we can crowd 35 providers that do not have an HIE address. Now, if they don't have an address, that's a little bit different. Mary, what are your thoughts on this? I mean, to me, it's meaningful use is about the attempts, and if it's going out, you're going to get credit. If it's not going out and they don't have an address, I don't think it's going to count.
Yeah, Cindy, I can actually jump in on this one too. Yeah, as long as they're sending it out, it's still going to count in their system, and NextGen does that MU, tracks that automatically through the advanced audit. So as long as they're sending it out. Now, in regards to not having the HIE address, I'm assuming you mean kind of the direct address. As of right now, so we actually reached out to NextGen to talk to them about this, about kind of what would be the next steps for this, and really all they had to say was that it's frustrating, and we know that, but if for whatever reason an organization in your community or who you're trying to refer to isn't active with a HISP or doesn't have a direct address, all you can really do is recommend that the organization engages the HISP or looks into direct at this point in time.
And I have some
so in order to
from her question.
Yep.
She said, we can't send the referral as they do not have the address for Share to find.
Yes, we clarified that just a few seconds ago.
Okay.
So if, in terms of looking at it, if it goes out and nothing happens to it, then you're going to get credit. If you don't have the email address, or as it states here, and it's kind of a, reading through the all aspects of it, then it's not going to go out and it doesn't count. So I think that's also what Lindsay is saying, and unfortunately, this is one of the challenges when you're trying to deal with information that is out of your control. Probably answered that really badly in the beginning, but it's really not in your control, but unfortunately it's not going to count. And I don't know, what is the, Lindsay, off the top of your head, what is the criteria for qualifying for this measure?
I have to check. I believe it went up to 1 because this is originally the threshold was reduced, right. But I'd have to pull up the rule. I'm pretty sure right now.
Yeah, I don't think you have to meet a whole lot of this. It's really about the,
right.
So if you're speaking specifically for meaningful use, as long as you're getting it out in some fashion, not necessarily for these 35 providers that don't have it, but if you have 35 who do or 10 who do, then you're going to still meet the meaningful use requirement.
Okay, thanks. So we have another question that's a follow-up to the previous question. So I'm going to read the previous question first and then the follow-up to it. So the first question was, can providers create a referral order and have another employee use Share to complete the order? And the follow-up says, I heard the response for the question. However, the template forces the provider to select a referral provider. Will Share still work without the referral provider selecting someone?
So the referral template workflow to place an order, it will let you, if you're going in through the NextGen Share directory, it will force you to choose someone or an organization in order to send the referral via NextGen Share.
So I think, Mary, what the question is, going back to that same old thing that we've been kind of talking back and forth, is the workflow. So the provider is not going to take the time to attach the documents. So if we set up a workflow, what I would propose is that while, yes, we're talking about placing an order for a referral, but they wouldn't necessarily do it using the template. They would, in my mind, have a workflow that they almost, I'm going to use a term, it's not exactly the right term, but without getting into training on the webinar and the time we have, I'm almost like a task. You would basically generate the order, but someone else would be responsible for actually following it through. Is that kind of what you had in mind, Mary, in terms of if they needed to attach physicians and the physicians won't? So they wouldn't initiate the referral through Share at all. The providers wouldn't. We would come up with a different workflow, and then someone else would be responsible for doing that.
Yes.
Okay.
And to kind of follow up on that one more step, and one of the groups we work with actually moved the NextGen Share, I'll call it the button, to another template for that logic, and they corrected their workflow that way. Not suggesting you do that, but there are ways around it because most physicians or a lot of physicians aren't going to take the time to do those attachments.
Okay. Thank you. Next question. In regards to the question for providers placing the order and the referral staff sending it through to Share, do you have to be on UD2 to get that to work?
This is Mary. No, that's just a workflow. So provider could place the order, and then staff could go back into the same template and send it via Share.
Right, but again, they wouldn't use the Share workflow. There would be another method for them placing the order and notifying someone else who had been placed, right, and that someone else needed to finish it. So that's really probably a better way of describing it.
Okay, next question. If we are unable to turn a provider to the off position in the NextGen Share messaging service, what could the issues be? What might be restricting this action?
This is Billy. I can take that one. I would check to see if they are set to be the default provider, because you can have a default provider set for each practice. And if they are not the default provider and you still can't turn them off, that would definitely be a NextGen ticket, because you should be able to toggle them on and off pretty easily.
Okay, thanks, Billy.
Mm-hmm.
Next question. This is a great product, but providers feel frustrated when they search for a provider and it's not available in the directory. What will be the solution for this?
I can go ahead and grab this one. We do understand it's frustrating when they're not in the directory, but someone may not have added them yet. So if you do have a direct address for a provider, we did go through the steps of adding a provider to the NextGen directory. And if you're adding a single provider, that provider will be available to you immediately, which is nice. So if they have a direct address, you can actually enter that provider in yourself. Again, if they don't have a direct address, then they're not a part of the direct messaging system, so you won't be able to send a message because that means they're not part of a direct HISP as well.
Thanks, Cynthia. Next question. Currently, the referral template locks for editing after a provider orders a referral. With Share, will this template lock for editing by the provider?
This is Mary. I can jump in on this one. So I assume you're meaning, and you can write back and clarify, but once the order is placed, that order is locked for editing, because you can't like reopen it back in the referral template and make a change. The functionality will be the same if you place an order searching for a provider using NextGen Share. You'd place the order, it would go down into the grid, and you would not be able to update that order. However, you could place new orders or, cancel that one if you wanted to make a change.
Thank you, Mary. Next question. We're doing syndromic surveil with
surveillance.
You want to take that one, Cindy?
Let me read this one. We're doing syndromic surveillance with KHIE and using the IRIS registry as our specialty registry. We don't need the NextGen clinical registry too, do we? And Mary, I'm going to let you grab that. I don't believe so, but I think you're a little bit more up on the conversations we've been having this week. So I'm understanding you've got the two registries, and they're saying that they don't need the other one.
Right. If you have two already, and I do not believe either of the ones you have listed, and I'm making myself a note to check and verify, but both of the ones you have listed are not ones that utilize the NextGen Share for the clinical registry, no. So you would not need that for that.
So the only reason that we're bringing that up is that some of the groups we work with are using those registries that do utilize the NextGen Share as the vehicle for communication, and in those cases, then you need to register through the NextGen Share, either the methodology for below UD2 or above UD2. If you're using third parties, and many of our clients are, you don't have to be involved in NextGen Share at all.
Okay, thanks, ladies. Next question: what is the best practice to search providers? It appears that the providers are in the directory, but does not display in the search window.
I can jump in. This is Mary, and Billy can follow up if he has anything else. So if you're searching, a lot of the groups I work with search by last name of the provider or by organization name. That also drills down the results, because if you're searching by location or by a specialty, you're going to get everything back. So I would recommend doing that. And then I see that the second part says that the providers are in the directory, but they do not display in the search window. I would need some more information to understand, are you searching for them, or are you thinking that they're just going to pop up, or are they not coming up by last name? Or Billy, do you have any other thoughts why they might not display when they are searched for?
Yeah, I was going to try to jump in there and talk, but I was talking on mute. So only a certain number of search results will pop up in the Share Provider search window. So in order to really get what you need, you'll need to try to, like Mary said, drill down a little bit on your typing. Either type in the full provider name, or also include specialty with that. Because yeah, if there's more results than what the Share Provider search will display, then you will be missing some of those providers, even though they're in there.
Okay, next question. We can't send the referral as they do not have the address for Share to find it.
That was earlier. That was when we were communicating. Yeah, we were communicating back and forth.
Okay, next one. Can you clarify the statement that SureScripts HISP will be discontinued July 1st?
Yep, I can go ahead and grab that one. Just that it's going to be discontinued due to Share, so a lot of the clients now are using SureScripts HISP as the way to communicate. So when we communicate HISP to HISP, they would be going through SureScripts. Now that NextGen has NextGen Share and it's up and running, they want all the clients to start using, obviously, and go through NextGen Share to start the direct messaging and communication.
Right, and when we say a lot of clients, I don't really think a lot of clients were, in terms of vast majority, some of the early adopters for NextGen Share and HISP communication, or not even NextGen Share, HISP communications were utilizing SureScripts. This is not an impact of your e-prescribing. It's a different thing. It's just that SureScripts is the vehicle. So, just if you're not using it as your HISP, it doesn't affect you at all.
Okay, thank you. And it looks like two people chimed in 10% for Objective 5A. So that must have been helping out with the previous question.
Yes, thank you.
Okay, and it looks like this may be our last question. So if you think of any more, go ahead and get them sent out. But it looks like the question is, could you review NextGen Register Share process again? I believe you mentioned we need to be registered by the 22nd.
Actually, they made a change in their requirements for UD2 and higher, and that just means any iteration of UD2, because the UD2 is the highest. And the fact that you can no longer do it via a list, you must do it by logging into the registry, and the requirements are by the 29th. It's not by the 22nd. The change was made on the 22nd, and that statement will be in the slides that we send out, and we can also send anyone the white papers that NextGen has had, along with the full statement that they were mentioning. Also, NextGen is having a couple of webinars on some enhancements to NG Share, and I think some of these things will be covered. We tried to get a preliminary copy for that before the webinar today, and we couldn't do it. So for those of you, I think there's some this afternoon maybe, and then some next on Friday, if I recall correctly. But if you didn't get that, check on the NextGen website to see about those presentations.
Okay, thanks, Cindy. Looks like we have another question. If a provider starts referral using the NextGen Share to a provider, can the referral coordinator change the provider when they attach the documents needed for the referral?
That would, again, be based on your workflow. If they have put the referral through NextGen Share, then my answer would no, I think you'd have to do a new referral. Mary, jump in if I'm wrong. But if you have a workflow that you're starting the referral, i.e., through a particular type of order, not necessarily a NextGen Share order, then you should be able to set up a workflow that would accommodate that, because the referral coordinator could make all of the changes they wanted it to finalize, and then they would be the person who would initiate the NextGen Share referral.
Okay, thank you, Cindy. We have another question. If we already have a list of external providers that is in NextGen Share, how can we build our own referral pick list instead of using NextGen Share to search?
That's one of the UD2 features, to build a favorites list, as well as the most commonly used physicians. You can build your favorites list for who you would want to search from.
Okay, great. Well, it looks like that's all the questions that we have right now. So thank you all for coming, and keep your eyes out for an email from me with links to the recordings. And don't forget to follow us on social media. We also always announce our webinars up there, along with weekly tech tips and all sorts of good information. And everybody, thank you for joining us. Thank you for presenting today. And don't hesitate to reach out to us with any follow-up questions. Enjoy the rest of your day.
Thank you, everybody.